Hello and welcome back, and I'm Dr. Ankit Gupta, and today's video is on axillary breast or the armpit fat or swelling just under the armpit area. So I'll be explaining this whole procedure through two different patients. There is no single surgery for it. I'll be explaining two different cases in which we have treated them differently. This first patient I'm showing you had a very mild underarm fat deposit. It was actually an axillary breast. There was fat as well as breast gland inside the armpit area. She being a model, even though the fat deposit was very small, was hampering in her day-to-day activities, and it affected her shoots and all. So she came to us to get rid of all this extra amount of fat that she had. For her, we decided to do a liposuction procedure. We did a very simple procedure in which there is no big cut given. There is a very fine half a centimeter cut given through which we introduce a fluid to numb that area, and then we suck out all the extra amount of fat and the tissues that is there, and we are able to contour that area into a much better shape. And this is how she looks after about 2 months. So all the area where she had an extra amount of fat has been sucked out, and now she looks much normal. Although there was not much amount of fat, but we were able to give her a much better shape, and for her profession she needed this. If I go on to this second patient, this again is the same thing, but this is of a much bigger grade. This is almost a very severe kind of axillary breast. This is almost like a new breast tissue that has developed in the underarm area, and in her also we did a liposuction surgery. First we did a liposuction to remove all the fat. As you can see, this is the huge amount of fat that we were able to take out in her. Then whatever extra skin she had developed and whatever the breast tissue remained, we had to cut it, because the extra amount of skin that she has developed, because she presented very late, there was a lot of extra skin, and we cannot reduce the skin through liposuction. We had to give a cut and to remove all the extra amount of skin, and once all the skin is removed, we have to stitch that area, and then this is how she looks after the surgery. So these are two different surgeries that we opt for. If you have very mild axillary breast, you can undergo only liposuction. If you have moderate, we can do a liposuction and see if it heals it. We don't need to cut it. But if you have a very severe axillary breast with very large amount of extra skin, then you need a liposuction along with skin excision. I would also recommend that you should always undergo liposuction combined with excision and not just excision, because it will reduce the amount of skin cut that you need. Because once we do a liposuction, it deflates the whole axillary breast. It's like if we have deflated a balloon, it will become much smaller, and then the amount of skin we need to remove is much less. So the cut given is much less. In case if you have an axillary breast, if you have such issues, you can WhatsApp us your pictures if you are comfortable, or you can talk to us. You can visit our website panashaesthetics.com or WhatsApp us on 9599554211, and we'll be happy to help you. Thank you and have a nice day.